Hey, I'm Dr. Rouse from Flatrock Family Dentistry. Here at the office, we get a lot of questions about sedation dentistry and is it for you? How does it work? And so I thought today I would answer some of those questions. So what is sedation dentistry? Some people are just nervous about dentistry. They had negative experiences and they just can't get over it. I mean, some people are good with just some of my jokes and they're fine, but some people need a little bit more than the jokes, right? So in that case, we would do sedation dentistry. In our dental office, sedation dentistry isn't knocking you out, but it is a nice, relaxing sedation where you just feel good. You're relaxed, you don't care about what's going on. It's just to help you be able to get the care you need and be comfortable. So why is sedation dentistry effective? How does it help you? Well, a lot of patients, they tell me when they come in, they can't relax. You know, they're so nervous about getting the dentistry that they need and they avoid it. I had one patient say she has left so many times. She's made an appointment, she sat in the parking lot and she's like, I went home. I didn't go into the office. I was so nervous. And so knowing that you're not going to have to worry about, do you feel anything? Do you smell anything? You know, are you going to be nervous? Just knowing that you're not going to have that happen allows you to relax and actually often for some patients come to your appointments. You know, some people just avoid dentistry. And so in some circumstances, you can get healthy without us helping you. Getting over that hurdle of coming to the office sometimes, knowing that it's going to be okay, is awesome. Sometimes patients may not be super nervous about dentistry, but sometimes people need significant care that takes a long time in the chair. And sometimes you just don't want to be laying there and being aware that you're laying in a chair for a lot of time. So sedation dentistry, if it's 30 seconds or 30 hours, it doesn't matter to you. Not that we would ever do 30 hours. No matter what amount of time it is, it's going to be okay because you're just relaxed and it's okay. So we can sometimes get more significant dentistry done at one time and that saves you time. So how safe is oral sedation? Very safe. There's probably two main types of sedation. One is IV sedation, other is oral sedation. I say both are very safe. With oral sedation, you're monitored the entire time. We have you on a pulse ox machine and we're monitoring your blood pressure, your oxygen levels. And the medicines we use are very safe, have a very high tolerance level, and we make sure to keep you in a safe range and you're monitored all the time. It's very safe. So what are the different types of sedation that are available? Sometimes it just starts with good communication. Some people want to know what's going on, and once they know that, they're okay. So it takes time to communicate with your provider so that you understand what's going on, that you feel comfortable with what you're doing and that it's the right thing for you. So sometimes just talking through things helps somebody. Obviously, that's not a form of sedation, but I think it's an important part of feeling comfortable in an office, right? We do have massage chairs. So when you lay down, you feel a little massage on the back. We do have headphones, and there's a TV on the ceiling that can distract you. For some people, that's enough. We do have nitrous oxide, laughing gas, right? You can drive to your appointment, you put this on, about 5 minutes later, you feel relaxed. It just takes the edge off. You still kind of remember the appointment, you know you're there, but it does relax you some. And then you're able, once you come off of it, you can drive home. It's very quick on, quick off, and that helps a lot of people. Some people need more significant sedation than that or just my jokes. Sometimes we will use oral sedation, which is great. Usually with oral sedation, you will take a little bit of medicine the night before. You'll take some before you come in that day. And then when you come in, we dedicate some time just to get you comfortable, to make sure you're feeling okay. You're monitored the entire time. Someone's dedicated to be there with you the entire time. And for that, though, you will need a driver, someone to drive you to the appointment and someone who would be able to take you home. And you need to be able to just relax the rest of the day. A lot of patients will just go home and take a nap. And a lot of patients fall asleep. They take a nap while they're in the chair too. They just don't remember what's going on. What can you expect during oral sedation? You can expect to be relaxed. We don't put you out. We don't have a machine breathing for you like you might in the OR, right? You have your own protective reflexes. If we say, hey, can you open up? You're going to open up. If we say, can you turn your head? You can be responsive and help us out, right? You just are relaxed. Some patients fall asleep. You know, that's okay. As long as we can keep working with you to sleep, that's totally fine. But some patients can respond to what we're doing, but very few just remember what's going on. They might remember that they were at the office, They might remember that, oh yeah, I think I remember you talking to me, but it's just really nice. I remember one time I actually called the patient that night to see how he was doing, just check on him. And his wife said that after a nap, he woke up and said, we got to get to the office, the dental office. I have an appointment today. And she's like, honey, we already did that thing. You know, you're good. He's like, oh, really? So I thought that was kind of a cool story. Some people ask, do I need sedation for a tooth extraction? Do I need a sedation for an implant? I would say that depends on you. Some people are totally fine with an extraction. Obviously, it depends on what kind of extraction, what's needed in order to get the teeth out. But some people really want to not remember a whole lot about what's going on there. And so if you're that person, then sedation is for you. Some people wonder, am I going to be awake for this? I guess that depends on your definition of awake. During sedation, you are awake in the fact that you do not have special machines you're not intubated and have a machine breathing for you. You still have your own protective gag reflexes. You still are able to breathe on your own. We don't get you that sedated like you might be for general surgery in the operating room, right? But you do feel relaxed. You do feel like you don't care about what's going on, and it's just a good experience. Some people ask, is sedation dentistry painless? Sedation dentistry is awesome because you are not remembering getting numb. The part of getting numb is you forget that part. We are numb for the procedure, so you don't feel anything. Also, just people are more relaxed. Sometimes there's like a tension. Some people might have a tension, so if they're really nervous, their shoulders might be sore after dentistry. Not because we worked on their shoulders, but because they're, just tight the whole time. This allows you to just relax and calm down. The jaw muscles are more relaxed. So typically, it's a better experience afterwards, and you just feel not as aware that you had anything done. What are the side effects of sedation dentistry? The most common side effect is that you're really tired when you go home, and most people take a nap. Of course, we do have to monitor your medical condition. We don't do sedation on anyone who we haven't done a full medical history on. We have a protocol that we would go through beforehand to cross-check any medicines that you're on, to review your medical history, to make you informed of what you need to do at home to be ready for that day. So there is certainly a protocol that we have that we need to go through to make sure that we're doing it the right way and that we're safe for you. Just like in the office, we have emergency medicine in the office in case it's ever needed for whatever reason. But in the end, this is just a safe procedure. And when we follow the protocols we have, we get great results. How would you request if you want sedation or not? We just need to talk about it. If you have a thought that you want to know more about it, or you think it might be for you, when you come in, you should just ask, what questions do you have about it? Would this benefit you or not? And we would just talk about it. Many patients find it as something that is helpful to them now. I certainly hope this has helped learning a little bit more about sedation dentistry. In the end, to know if it's for you or not, or what we would do, what's the best situation for you and your dental care, just come on in and we can talk about it. I love talking to patients. I love dentistry. I love when patients get healthy, and this is a really great tool to help people get the care that they need. And so just come on in and we can talk about it.